So we'll start with the all-important financials. Of course, this is critical to everything we do. We finished the quarter with $16.7 million in the bank, as opposed to last year quarter where we had $20.6 million in the bank. And subsequent to that, we've added to our balance sheet in two very important ways. We've added $6.4 million net of costs from a fundraise we did last week, and also a loan from the Walloon region, an unsecured loan for a further $1.5 million. All that adds up to, I think, a very strong position for us to deliver our milestones. Also, don't forget, we have $18 million outstanding on the 3 remaining milestones with Heska, which we'd expect to get at least 2 of them in the next few quarters, another $13 million. And as importantly, we've kept the burn rate to around $2.1 million a month. Given everything we're doing, I think that's an extremely good achievement. So apart from a very strong financial quarter, we think all the things we did have been very productive. The first time in 3 years, we had a conference in Namur in Belgium. We are a multinational, a very small multinational. We're still about 100 people, but it was great to see our Asian team, our team from Europe, our team from the US, all working to commercialize our platform now in a wide range of areas. And the pillars have been fantastic. And the ones we're focusing on today are Nu.Q NETs, Nu.Q Vet, and Nu.Q Discover. Nu.Q NETs, one of our most important pillars. We got 2 CE marks on the plate format and on the automated machine format. What does a CE mark mean? That means we can sell it clinically in over 27 countries in Europe, which we estimate just for sepsis alone is a $6.5 billion addressable market. Now, a CE mark means you can sell it, but what makes people buy it? We're also going through a large process now of getting early adopters. The $1.5 million we got from Belgium, we're aiming to put a machine in 10 sites to really drive the use cases. We're working with some absolutely outstanding key opinion leaders. Through the early access programs, we aim to get it adopted for a wide range of uses. And we have now signed an arrangement with DXO, very large program. It's thousands of samples across competing conditions, sepsis and cancers. And that will really help us drive first meetings with the FDA and hopefully the breakthrough designation application approval. Another milestone, MD Anderson Cancer Center, you're probably familiar, absolutely top class. Tragically, if you have cancer, you're 10 times more likely to get sepsis. And of course, that's also incredibly deadly. So we're working with them to see if we can help clinicians to target people who are very susceptible because of their NETosis background levels to develop sepsis when they have cancer. And that's a study which will also be done and really good validation of what we're doing. So Nu.Q Vet also, like Nu.Q NETs, has made extremely strong progress this last quarter. And it's only a few short months since we signed Heska, and that they have been working very closely with us, adapting it to their platform for the release in point of care. That's gone very, very well. It's still very much on target for end of this year, early next year launch, which means they'll be selling it starting in the US and Canada and soon hopefully worldwide at the point of care, a huge breakthrough. Also, they're also working on their own launch in labs in the US as well. So expect to see a lot of news on that end of this year, early next year. We've also launched in Singapore, and we've made strong progress with other large companies we've talked about, which would help us launch worldwide. And also, depending on which ones we sign, but up to 80-90% of the US vets would be covered if and when we sign one of the big vet companies as well as Heska, and we are expecting that to be this year. So from a product point of view, not only are all the signings of the contracts and the launchings upcoming, we've also expanded the use cases. So we've released data on the monitoring side, monitoring the same cancers for treatment. So we're really hoping we can launch that product in the next few quarters as well, and also in a range of other cancers in dogs. So full congratulations to the vet team, a fantastic quarter, and I think the best is yet to come. Nu.Q Discover is also very exciting, and the final pillar we'll talk about today, working with 7 different organizations using our platform for what they do, from biopharm, animal, human, different drug projects. This means we're getting early revenue from these companies and organizations, but we're also really getting at the heart of a lot of research programs and drug programs, one of which might start going into human trials this year. And it's very hard to predict what the revenue will be because it's a lot of other companies. but just another pillar of what we're doing, and we really want to help as many people and groups as we can through our fantastic NewQ platform. So in summary, on the financial side, I think we've been very nimble, we've kept costs low, we've got financing from a few different sources, we're very close to launching worldwide in the vet space. We have now got a product in Europe we can sell in NETosis. We're working on a large range of use cases for early adopters. We've also just announced our US strategy and in cancer and in sepsis and NETosis. So all in all, I think we've done a very good job leveraging everything to commercialize our platform. And we want to make sure we do not ever need a large sales force. We do not need large CapEx or OpEx, so we can grow very quickly once it takes off. And that's the position we're putting ourselves in now. So stay tuned. It's going to be another exciting couple of quarters ahead of us.